Hi, this is Dr. Rob Jones. You may have called me as a patient and said that you had your annual physical from your doctor, and you went in and he ran a blood test on you, and it came back and he said, hey, your thyroid is way too high. Well, I'd like to answer the question, and I'm going to get a little bit technical on you, but you need to know the answer to this, and you need to relax about it because that's not really the case. Your doctor, all doctors out there, unless they do bioidentical hormone therapy like we do here at Utah Wellness, they are used to prescribing something called Synthroid or levothyroxine or Levoxyl. Those are synthetic thyroid compounds, and they are what we call a T4 compound. So T4 converts into T3, and T3 is what makes you feel good. So T4 is a storage hormone, and T3 is the active hormone that makes all the changes. So what happens is somebody goes in for their annual physical, and the doctor says, okay, we're going to run a blood test on you, and he does a test called a TSH. That stands for thyroid stimulating hormone. And we get these calls all the time, and everybody's worried, and you don't need to worry because your thyroid is where we want it. But he'll say, well, we did a TSH and it shows that your thyroid levels are way too high. Well, number one, the TSH test, it stands for thyroid stimulating hormone, but it's not a thyroid hormone, it's a pituitary hormone. It's a stimulating hormone. And if we're giving you enough thyroid, you don't need to stimulate your thyroid anymore. So that thyroid stimulating hormone level is going to go down, okay? It's going to be close to zero. It'll be between 0 and 1.0. And your doctor is going to be alarmed with that because he's not used to giving you the type of thyroid we're giving you. We're giving you natural thyroid, which has T4 and T3 in it. The kind that he uses is only T4, no T3. And it's the T3 that brings the thyroid stimulating down close to 0. That's exactly where we want it. The other problem is a lot of times you go in for that blood test and you go in the morning and you just took your thyroid, the kind we've given you, you just took it that morning, you go in and 2 hours later he draws the blood, or his phlebotomist draws the blood, and then they run it to the lab and it comes back, oh, your thyroid's too high. Well, you just took the thyroid, and that's going to suppress TSH. That's actually what we want it to do, but a lot of doctors don't realize that. They aren't used to using that type of thyroid. So in the end, it's not a problem for that to happen. I don't want to confuse you with all the details, but again, they use a T4, we're using a T3 and T4 that has a different effect. So if he says, oh, get off your thyroid, or stop taking it, or your thyroid's too high, that is not the case. The one way that you could find out if your thyroid is too high would be if you stick your hand out in front of you like this and you're jittery, or you feel like your heart is racing all the time. Those would be the signs that your thyroid is too high. Now, I just got a call from a doctor the other day. One of our patients who's on thyroid, she's about a 23-year-old girl, and the doctor said, I think she's taking too much thyroid. And I said, okay, why is that? He says, well, we checked her and her TSH was really low, meaning her thyroid's too high. And I said, okay, doctor, I appreciate that. Are you aware of what kind of thyroid she's taking? And he says, well, I think she's on natural thyroid. And I said, yes. Are you aware that that's T3 and T4, and you're used to only giving T4? And he says, well, what difference would that make? And I said, oh, on the testing, it makes a huge difference. See, a lot of them, because they never use that type of thyroid, they don't understand it. And so once I explained it to him, he said, well, that makes sense. Okay, then I won't tell her to stay off her thyroid. And I said, by the way, how is the patient feeling? He says, well, she was in for her annual physical. She says she's feeling great, but we just saw that. And I said, you probably drew the blood that morning too. Did she take her thyroid? He says, I don't know if she took it that morning or not. And I said, well, unless you told her not to, she would have. We tell them when they go in for a blood test, take it the morning before. And if they're taking some in the afternoon, they can take it the day before, but they shouldn't take it the morning of the blood draw. Otherwise, it's going to appear way too high. So that's a long way of saying You're probably okay. If you stick your hand out like that and you're doing that, or your heart feels like it's racing, then I'd want you to call me and talk about this. Now, if you'd like to read about this in detail, what I would suggest you do, there's a public website out there. It's called www.stopthethyroidmadness.com. That is a website written by two women to explain everything in detail to you so that you can then explain it to your doctor. So this is a very common question. It's not an unfair question, but it's just that the doctors a lot of times don't understand the difference between a T4, like Synthroid, and a T3, T4, like Armour Thyroid or Westhroid or Naturethyroid. And by the way, one other thing. You may have a lot of other questions on other health topics. If you go to utahwellnessinstitute.com/answers, we have a list of all kinds of interesting answers to questions that our patients ask us the most. And they're in a YouTube format, so you can just click on one that you see on our website and listen to it. They're all about anywhere from 2 to 5 minutes, and you can just see the topics and listen to them there. I think you'll learn a lot. Thanks.